Hello, and welcome to Facebook Live with Dr.Brie. I'm here today to chat with you about hormone testing and all of its various nuances. And I wanted to start with, why are we doing testing at all? Because that is where the controversy begins, unfortunately. I have done, as you know, women's health and hormone therapy for men and women all through the stages of life, from fertility and conception through perimenopause. And I find it really fascinating to me that there's still a debate about doing hormone testing. I really love hormone testing. I think it really helps a lot. I love data though. I'm a data head. Everybody knows that. I think it's great to know, what you can from the technologies that we have. And in 2026, we have a lot of technology and a lot of ways of looking at things. Sometimes that makes it awesome. Sometimes it makes it really confusing. So, what I want you to know, big picture today, is that hormone testing is still not a standard. As you know, you can go to your doctor today and you can say, I want my hormones tested, and they can, generally decline or talk you out of it. So, you can still ask, and asking is, you're right as a patient. I'm not giving you specific medical advice today or advertising any one given company, but because I've used so many different technologies for hormone testing, I just want to give you a big lay of the land. But the typical blood testing, LabCorp Quest testing that you do at the doctor's office, is good for hormones, and sometimes it really depends on the hormone and the type and the timing and where you're at in your life and what you're looking for. So that's the problem with lab testing. That's why doctors have seemed to guard it over the years, is that we want you to get what you want out of lab testing, and just because you can test something doesn't mean that it's always going to give you the answer that you're looking for. So I'm going to focus this talk around primarily perimenopause and with some pearls about fertility testing, because we get a lot of and for men, hormone testing for testosterone, we get a lot of questions about, like, can I still get pregnant or am I in perimenopause? So we'll try to give you some guidance there. But the big picture is, lab testing versus advanced testing. So I'm going to go with testing is always great. And then individual hormones are unique. Every single hormone is different, and depending on what you're looking for, that is going to drive where you want to get the testing done and the type of testing that might apply or be the best for you. If you want to do advanced testing, you'll need to find a functional medicine, alternative medicine, lifestyle medicine doctor, like direct osteopathic primary care, because most standard doctors don't have access to those labs. They can't even order them if they wanted to for you, because you have to have an account with the specific advanced labs to be able to order those. So something like the Dutch test can only be done by providers that have an account with Dutch. Same thing with our office. We use ZRT Lab and Genova primarily because they have such a good offering of labs at a really affordable price point. And so that's why we end up having a long-term relationship with them. I think I've been a provider with Genova since before they were Genova. So it's been going on 15 years now. And I even talked to the developer of our new test, Women's Health Plus. He's a brilliant man and a brilliant doctor and scientist. And it was really lovely chatting with him about how they developed both their Endo Plus and Women's Health Plus, the newest offering with Genova. They're really happy to have added that to our healthy hormone assessment program. But if we backtrack a little bit on the why and how, okay? So why is because you just want to know, right? I think hormones are best for a baseline, right? It's best to get a baseline. Where am I at? What's happening in the playing field? That is a great reason to get hormone testing. Tracking hormone therapy is another great reason, in my opinion, but it is a little more complicated, and not every version that we're going to talk about today is helpful for tracking therapy. And tracking therapy gets really nuanced in terms of timing, probably outside the scope of this conversation and the attention span of humans on Facebook these days. So baseline testing, part of our healthy hormone assessments, that's where we get into the advanced testing. You can also do baseline testing with regular labs, blood draws and LabCorp. You might also want to do hormone testing to understand your fertility, and you can do that even before hitting a reproductive endocrinology office or running into a problem. The primary difference around fertility and around Perimenopause is looking at a thing called your anti-Mullerian hormone for women. That looks at your ovarian reserve and the chance that you'll respond to something like Clomid. And that's a good number if you're, greater than 35 and, under 45, you want to get your AMH, anti-Mullerian hormone tested. That can be really helpful for just getting a window into, are my ovaries ready still for me to have a baby. And that is a women's only test and should be interpreted by somebody who knows what they're doing. But that one is a good one to add if you're asking for standard labs and that's the question you want to answer, where it's my fertility window. The other thing about hormones is when to test them. So for men, it's super important to test your testosterone in the morning. Men have a diurnal testosterone approach. That means it's high in the morning and it decreases throughout the day. So if you get your testosterone checked at 3 in the afternoon, I don't really care what it is because it might be low. And we don't know then if it's low because it's just the afternoon or if it's actually low. So I recommend that men get their testosterone tested before 10 a.m. It's typical to say 9 a.m., but any time in that morning time is important because that's when your testosterone is going to be the highest. And to diagnose low testosterone in men, you have to have 2 morning testosterone levels that are both low. Now, low, that is tricky because it's a big wide range. So interpretation of lab values has to be in the setting of somebody who knows what they're talking about and can match up your symptoms to not only your total testosterone, but to your free testosterone. And that gets us into the next complicated piece about hormones that we'll talk about today. The hormones and how they travel in the bloodstream really influence where it's tested, how it's tested, and how to interpret it. But testosterone in particular is bound by a very important protein. So you think about floating around in the bloodstream, right, with this hormone, but it has to be kind of chaperoned by a protein. So this protein is called sex hormone binding globulin, SHGB. And that binds your testosterone for men and women. So this makes the testosterone picture really, really different. If you're looking at a total testosterone in a blood level, you're not going to really understand how much is bioavailable to you as a person. What do you feel? What does your body make available? You could have tons and tons of testosterone floating around, all bound up. You're not going to feel it. So when you do a test with LabCorp or Quest, you can get a free and a total testosterone, and that's an assay that actually tries to measure your free bioavailable testosterone. But another way of looking at that is a calculation called your free androgen index, and that is done by taking your total testosterone, your albumin, which is another binding protein, and your sex hormone binding globulin, putting them into a calculator online. Make sure you get the units right. Probably, AI can solve this for you. But that free testosterone amount is really going to tell you a little bit more about how you feel, and you can match that up to your symptoms. And that's standard lab testing for both men and women. And testosterone, in my opinion, is best by standard lab testing. And we'll talk about why in advanced testing in a second. But the next thing to know is for women, the timing around your cycles. Now, if your cycles are irregular, you get your labs drawn, whatever, and then you can compare it. There's some reference ranges on the lab for the early stage, follicular, middle stage, ovulatory, or luteal stage right before your period. It's a little challenging, right, to know sometimes where you're at. If you look at those ranges, they're really wide ranges, which is why you have to have somebody who knows how to interpret them. And again, for women as well, compare the results to how you're feeling. That's the most important piece. So for women, we typically recommend either day 3, so early cycle, when hormones are supposed to be the lowest. We want to see the low of the low, we can do day 3. If we want to see the peak of your hormones or the higher place, we do days 19 through 25, and that's a different viewpoint. And again, it's all about what are you looking for. If you're looking for something like, am I ovulating? Or, am I able to maintain a pregnancy? Or is my progesterone high enough? Then you want to be in that luteal phase, right before your period hormone testing. You want to see kind of that peak. What does it look like at the peak? But if you're in perimenopause and you're like, gosh, am I bottoming out on my estrogen? What's happening? I'm having hot flashes, I'm not sleeping. Then you want to know that low, and a day 3 value is a little bit better. There's other tests too, in addition to estrogen, progesterone, testosterone, like we're talking about. There's also FSH, which is what your brain for women thinks about what's going on with your ovaries. That's another really good one in perimenopause, because really helps us to understand, also in fertility, what does your brain think about what your ovaries are doing? Kind of like your thyroid, your TSH tells us what your brain thinks about how stable your hormones have been for your thyroid, your T3 and T4. Your FSH tells us how stable your ovaries have been producing your estrogen levels. So you might capture a moment in time of normal estrogen, but if your FSH is sky high, then that tells us that your body hasn't been seeing normal estrogen levels over the last period of time. And that's helpful for your provider to understand. So those are some of the big ones in the blood work, okay? So in our office, we talk about the blood work is like looking in the hallway for how busy we are, right? If you look in the hallway at a doctor's office, you're not seeing all the patients inside the cells. The complicated thing about hormones is that they're bound in the blood in the hallway, and then they are let into the cell where they are active. That's like being inside the room. That's where the patients are and the doctor is, right? With the busyness. That's where hormones are used, is inside the cell. So when we look at the hallway, the regular labs, that gives us just a snapshot. It's literally like, here, today, at this moment, this is what we can see in that one blood sample. I like getting multiple data points. So if you're over 40, I like to check your hormones a couple times a year, especially if you're symptomatic. Maybe it's just once or twice, but getting a couple of data points, like where am I at and what's my trend, I think is a lot more helpful than one single point in time when it comes to the labs in the blood work. But I love saliva testing, and I know this is controversial in the world of Western medicine, but I've been a big believer in saliva testing all of my career, even when I was a medical student. Studying with functional medicine and integrative medicine providers made me a believer, and here's why. So when we think about that intracellular level, there's no way to measure it. You can't go inside a cell and say, how's your estrogen level doing? Or how's your cortisol level doing? Which we'll talk about, okay? So it is not possible to do an intracellular level. But when you spit into a tube, you are spitting along what's called the capillary extraction of where some fluid comes in from the intracellular. It's an approximation of the intracellular hormone level. And it's not totally like, 100% believed by everybody. But if you look at, ZRT Lab and you look at some of their online education materials, you can see why those of us that believe in saliva testing believe that it is a valid viewpoint. I always tell my patients, it's like apples and oranges. If I look at your testosterone in your blood work and in your saliva, I know that I'm looking at apples and oranges. I am not looking at two of the same values, especially for testosterone. Testosterone in the saliva and in general saliva testing really only looks at the free or the unbound hormones. So if that's what you're trying to look at, that's where you want to look. But some women have a salivary enzyme that inactivates their testosterone. So it actually makes the testosterone in the saliva really inaccurate for some women. And you don't know who that is, right? So I always look at testosterone in saliva with a grain of salt. I'm like, well, let's get an idea of where it's at. But what I'm really after saliva for is for cortisol. And I like it in instances of estrogen, progesterone for a baseline, especially progesterone if we're looking to see if you're still ovulating. Then I like to look between days 19 and 21, that luteal phase, right before your period. I want to see, does it look like you're ovulating? Because we can predict that pretty well by understanding your progesterone in the saliva. I personally don't like the progesterone in blood work at all. It's really not very helpful for me as a hormone provider. So if I'm looking at the saliva, I'm always thinking about the bigger picture of your hormone cascade. And I'll put Dr. Brie's hormone cascade in the comments. But when we have to really think about hormones, I want you to think about a multi-level Hawaiian waterfall. We've talked about this before. At the very top of the waterfall is the primary compound that all the hormones are made out of, cholesterol. It's the backbone, okay? The next waterfall comes down and we have pregnenolone, progesterone, cortisol, DHEA, testosterone, and estrogen. Now, this is a complicated biochemical relationship, but I like to really simplify it for people because I've noticed for years clinically that when you come into perimenopause or your later years for men when your testosterone tends to dip, that many people come in on adrenal fumes, right? So they've been chronically stressed for years or decades, and they've been really running on that cortisol, pedal to the metal, tired and wired. And that takes away from your DHEA, which contributes to your testosterone level and then your estrogen level downstream. So when I suspect chronic stress is a part of your picture, if you have been stressed for a period of time, I want to know, are you tired and wired, or are you in the burnout phases of your cortisol curve? And the only way to get a cortisol curve, a 4-point cortisol curve, which is the best way of looking at it, is to do saliva testing. And this has been validated. LabCorp Quest, even some of the newer big panels that let you do your own labs, they have a morning cortisol, just a single AM cortisol. I don't find that really useful at all. I really want to know, what does your cortisol look like first thing in the morning? What does it look like midday? What does it look like in the afternoon? And what does it look like before bed? Because it should start high and then it should go down and down so your brain can go to sleep. And it should not go up in the middle of the night at 2 in the morning like it does for many people. So when I look at the bigger picture of somebody's hormone assessment, I want to get the lay of the land, the broadest perspective. And that's when I want saliva testing so that it can include the cortisol curve. That's my number one favorite thing of both the ZRT lab and Genova's testing that we do. But then Genova added a couple of bells and whistles. And this is where it's kind of on par with what people do with Dutch testing. What Genova added in their Women's Health Plus and their Endo Plus testing is they added urinary estrogen metabolism. What is that? That tells me about what's coming out in your urine, right? A whole different viewpoint. We had our hallway, then we had our room. What comes out in the urine is kind of like what you flush down the toilet, right? You actually want to see, like, that gives us an estimate of your total body estrogen, total body excretion of the metabolites of estrogen here. And that's really important for us to understand because estrogen metabolizes good, bad, and ugly. So we want to know how much of those estrogen metabolites and which ones are you making. And that's really helpful in the women's health test that they just rolled out. But the last thing they added in was micronutrient testing or organic acid testing and genetics. And all of those allow us to personalize our understanding of your bigger picture. Some of those genetics tell us about how you manage your stress hormones. Some of those genetics tell us about how you detoxify the inflammation in your body. Some of those genetics can even tell us about, whether or not you're at risk for, Alzheimer's or how your heart health is. So Genova does a great job with these genetic add-ons. It's so affordable, and that's one of the reasons why we use them. But they took that micronutrient test. Are you getting enough B vitamins? Are you getting enough antioxidants? Are you getting enough magnesium, right? And they combined it with salivary cortisol testing and with salivary hormone testing and with urinary estrogen metabolism. So now we have that whole 360 view. And we can really look, if you're fatigued, where could it be coming from? And what are the levers that we can pull to get you feeling better and get you feeling like yourself again? Is it a hormone problem? Is it a stress problem? Are you not eating enough, fruits and vegetables? We can actually see that in this advanced testing. So if you want to know about your hormones, you should absolutely feel empowered that is your ability to know. It's 2026. You can know whatever you want, but be careful the tool that you use. If you want to know about your testosterone level, check it in the morning, check it with basic labs, with blood work, make sure and get a free and total and a sex hormone binding globulin. And if you're a man, get it before 10 a.m. If you want to know about your estrogen, decide if you want to look at the peak or if you want to look at the valley, right? And then you can decide based on your cycle when you want to have that blood drawn, okay? If you want to know about your fertility, don't forget to ask for an AMH. If you want to know about your stress, you have to collect your saliva or the best way, in my opinion, is to collect your saliva with one of the advanced tests. And if you want the whole big picture, I do highly recommend the genetics. For CompT, MTHFR especially, they both really impact how your hormones and your body detoxify and kind of unwind, right? Not only just mentally, but physically. And then, of course, always work with somebody who can help you match the tool to the answer that you're trying to find. All right, you have a great day.